stressful times, it's human nature for some people to narrow their focus and focus only on the negative and what they do not have control over. They don't step back and look at the big picture. And this may be the case for some when it comes to the COVID-19 virus. They take the narrow view and only look at the daily numbers of diagnosed cases and deaths. Yes, these are scary numbers, but they're not all the numbers. Let's look at some other numbers. It's estimated that about 80+% of those diagnosed with COVID-19 have mild to moderate symptoms and don't require hospitalization. They treat themselves at home with either doctor's prescribed or over-the-counter medications. There are many, many more individuals in the population who have undiagnosed COVID-19 and are again treating themselves at home. I also understand that about 25% or more of these people who have COVID-19 show no signs or symptoms of having the disease, although they are carriers. Further studies show that 78% of those admitted to the ICU, and most were over 60 years old and had at least one pre-existing condition, such as heart disease, diabetes, asthma, a lung condition, a weak immune system, or they were currently undergoing radiation treatment. Now let's talk about what you can't control. You can't control the above numbers pertaining to the COVID-19 virus. You can't control the fact that you or a loved one may or may not catch the virus, or how severe your reactions will be if you do catch this virus. All of that is out of your hands, so why worry about something you can't control? Now, here's what you can control different things, and by looking at the big picture. And this is the big picture of the virus. Approach your thinking this way. Okay, if I do get the COVID-19, what's the worst that can happen? Yes, I could be hospitalized. I could even die, but the odds are extremely low unless you fall into one of the above categories. So for the greater majority of you, if you do catch COVID-19, your symptoms will range from not knowing you're infected to not feeling very well to feeling miserable. And depending on the severity, you may or may not be hospitalized. Hopefully, you and your family members are already self-distancing, washing your hands, limiting outside personal contact, and maybe even wearing masks. These are things you can control. You can also control your reactions that you could have if you do get diagnosed with COVID-19. It might help your anxiety if you and your spouse or anyone you happen to be living with plan ahead on what to do if you or a family member get COVID-19. Identify a room where one can be quarantined with the least interactions or disruptions for other family members. Have paper plates and plastic cups and utensils for the infected person to use. Have a lined trash can close to the quarantine room so that the infected person can get rid of whatever they need to get rid of without any contact with other people within the family. Have a supply of disinfectant wipes handy so that all surfaces touched by the infected person can be wiped down immediately. And have someone lined up to watch the kids if you need that, in case you have a doctor's appointment or, worst case scenario, you are hospitalized. Remember, many, many more COVID-19 victims are treated at home and not sent to the hospital. And fewer still who are admitted need ICU, and only about half of those in ICU need ventilators. By focusing on the big picture and not the small, and what is within your control may help you ease some of the anxiety in these trying times. Mark Twain said, "His biggest fears never happened."